Thank you very much and welcome Wakefield to our bi-weekly COVID Odyssey. Hopefully you're all staying safe today and off the roads. Please be cognizant of that because it is getting very slippery and sloppy out there. And hey, your safety is number one in all issues, not just coronavirus related. I guess I still remain cautiously optimistic that our seems like we've turned the corner, and I know that everyone says, but I'm going to be upbeat about this, and hope I'm getting a few more nods now than I used to get, like a few more smiles. So we are doing well as a region anyway, and that I think that's because of a lot of hard work done by a lot of people in this community, some on this call, some not on this call, about getting the word out and getting vaccinated and staying your distance and doing all the things that we asked you to do to keep everybody safe. So without further ado, let me turn that over to Anthony to give us the latest and greatest. Anthony, you are on.
Thank you, Steve, and good morning, Wakefield. So we're going to start with a couple of announcements just to get some of the things out of the way. We do have a clinic coming up, a booster clinic at the Hurd School. It's 26 Cordis Street on February 9th from 11 a.m. to 3 p.m. We'll be offering the Pfizer booster. We do recommend that pre-registration before you go. So the link is going to be available on our website. So please, if you haven't gotten the booster, it is definitely a good way to protect yourself and everybody around you moving forward. Another announcement for us is the next Board of Health meeting, February 16th. We will be reviewing the mask mandate at that meeting. We'll be looking at the numbers and making sure that our decisions are evidence-based and following the trends right now. Another big announcement is that Pfizer has officially submitted their data from their clinical trials to the FDA for review. This is for the COVID vaccine for kids aged under 5. And so this is from, I believe, 6 months to 5 years. For reference, the last time they submitted for approval for the 5 to 11-year-old age group was just over 4 weeks in terms of timeline from submission to approval. So this may be coming down sooner rather than later. And we're very excited for this data to come out and see if we can get this into the community as soon as possible. This age group is one of the last ones for us to really get vaccinated and make sure they are protected as much as possible. In terms of case counts in Wakefield, we've been seeing a precipitous drop in the average daily cases. We currently are looking at about 12 average cases per day. Again, we're gonna give this a little bit of a caveat. Not everybody is going to do PCR testing right now. A lot of people are turning to the antigen test, both because of availability and because the antigen test is very helpful in detecting active infection. And so we want to make sure that folks understand if you have had COVID in the last 90 days, testing PCR will possibly reveal a positive result, result in a positive result. And so we want to make sure everybody knows that if you've been positive in the last 90 days, we want you to monitor for symptoms, but PCR testing would yield another positive. In terms of total active cases, we are at 229 active cases at the moment. We would like to see this number go down. We want to make sure that we continue to do everything that's been working. Steve already highlighted them in the beginning. Make sure to reach out to us if there's any questions about isolation and quarantine protocols, and we'd be happy to answer those and provide resources. In terms of vaccination rates, we've been doing a great job. A lot of the age groups here are over 80% in terms of getting both shots. We would like to see that booster percentage go up. In terms of the data, we are looking at just over 60% for some of our age group, and for our younger age groups in 12 to 15, we are still around 30%. So we want to make sure that we are having our community understand the importance of the booster, and we will be bringing more opportunities to our area for everyone to access them. In terms of positivity rate, the most updated positivity rate is actually around 12% here in Wakefield. It's pretty much in line with the rest of Middlesex County. And so one of the things we've been seeing again is less testing by PCR, and that's the only data that's feeding into this positivity rate. So even though we are, over that Omicron surge right now, we do want to make sure that we continue to do what works to keep these numbers down.
Thank you. And Anthony, on the vaccine clinic on the 9th, there are still plenty of slots available, correct?
Yes, there are lots of spots. We have a good amount registered, but we still have a good amount of availability. So if there's any questions about how to register, if you know somebody who doesn't know how to register or is unable to, please give us a call. Wakefield COA has also been an amazing partner in all of this. They've been helping seniors sign up for this clinic as well. So if there's any questions, please reach out.
Can I ask a novice question that people might have? It's a Pfizer booster. If you had a different brand earlier, can you do the Pfizer booster?
Yes. So if you had Moderna first, or if you had Johnson & Johnson, you can get the Pfizer booster. It is perfectly safe.
Thank you. And this is just
for the question.
This is just booster shots at this.
Just booster shots.
Just the booster shots, which would be the 3rd or the 2nd if you had the Johnson & Johnson. Great. Thank you, Anthony. Some positive news. Thank you. I do want to move over to our chair of the town council before I go around, Julie Smith-Galvin, who's been incredibly supportive of all our efforts.
I really don't want to take any time. This is great news. I'm interested to hear what's happening with the schools. And you said a lot of hard work being done by everybody, and everybody's gotten a vaccine or had their kids get it or has quarantined. You're part of that. So thank you to everyone.
Thank you. Thank you. All right, why don't we segue right over to Superintendent Lyons.
Good morning, everybody. Thank you for having me again. So before I jump into COVID numbers, Anthony, can I just ask clarification? Guidance on quarantine. So if I'm a close contact outside of school, quarantine guidance would be, can you fill that in for us?
Yes, absolutely. So for unvaccinated students, and staff, the quarantine protocol is 5 days. And then we recommend testing on day 6. And so we want everyone to monitor for symptoms through day 10. For if you are an out of school close contact, especially if you're in home close contacts.
Right. And so we would give the same advice in school if you were not vaccinated. And so yes. I bring that up because we've gotten several questions as it relates to the new program and as to us scaling back contact tracing. Quarantine and isolation guidance is still in effect. It's in effect in school and outside of school. So if you have questions about that, the Board of Health has been a really great ally for us. Please don't hesitate to reach out to Board of Health outside of school or to contact your school nurses if you have any questions about this. In terms of numbers in the Wakefield Public Schools, we continue to trend in a downward direction. This week, we have 66 positive COVID cases with 62 students and 4 staff members. Our numbers in quarantine are only 35. So that is also an encouraging trend as well. Those numbers on the dashboard on the town that Steve just put up or Jen put up are up to date and are current. And so we will also be sending that out in our weekly guidance that we send every week. And we're also going to be linking to our guidance information that came out from the state in regard to the new testing program and what are the expectations for quarantine and isolation. And so an update on the new program in terms of students and staff members and their ability to opt in to receive rapid antigen tests to take at home, in addition to being tested at school if you're symptomatic. Right now, we have almost 1,700 personnel signed up for those tests, which is a strong number. We feel like that's a great number. We would love to see it a little bit higher than that. So if you have yet to sign up or if you have questions about opting into that program, I know I think some parents were under the impression that they didn't have to opt in, that they would automatically be in, but that's not the case. So be included, but that's not the case. You have to opt in. If you have questions, please do not hesitate to reach out to your school nurses or Christine Bufagna at central office. And so that's it for me this week. Thank you so much.
Thank you, Doug. Tom Walsh. I lost all my people here.
Good morning. I really have nothing to report. That I think Anthony covered most of everything, and we're still trying to get our town healthy or safe as we can. The only thing is on that vaccine clinic, I believe the actual address is 27 Quarters. but once you see the former herd school, you'll know you're in the right spot.
Thank you. Thank you, Tom. Laurel Gorville, Board of Health, thank you for joining us again.
Good morning, everybody. And yeah, I join in the cautious optimism on these numbers. In contrast to that, we are reporting a new variant. And, you know, I really think we're learning to look at metrics in a different way. And so I'm keeping, Anthony talked, just to segue on evidence-based practice. We've been getting emails really urging us to look at certain articles. I really want people to know that every day I get emails from Medscape, which is a very well-respected collaboration that just pulls kind of the hot topics of the day. And I also just had the privilege of being part of the American Camp Association and the Association of Camp Nurses, who are really using a couple of vignettes that I just want to share that might be helpful. So one is, our crystal ball is murky, right? So we're making plans for the summer, and whether or not we had really good luck last summer with cohort management, pre-camp testing during camp. We had less than a 1% breakthrough. And actually, the last 2 summers of the camps that had opened had less illness burden at all, right? Because our campers are actually washing their hands all the time and being a little bit more cautious. So all of the usual campus crud things that happen went down tremendously. So there's we've learned a lot of things. The other piece is a reminder about what mRNA vaccines are and what they're not. And I can attest, because these vaccines, the Pfizer and the Moderna, that's why we had, I was so proud of our vaccine clinic efforts. One of them goes into deep freeze, one of them not as frozen, but it's because they're really the purest vaccines we've ever had. And the science is quite old, not old, but not, the science is not 3 years old. mRNA has been in research for years. And basically it is, messenger RNA is an email to your immune system that a virus with a certain kind of DNA is after you. So here's your recipe, get ready. It's got some lipid in it to maintain stability when it's mixed up. And it's got something called PEG, which is what is the content of Miralax. So when we ask people if they have any allergies to something like Miralax, which is basically a very ubiquitous ingredient that people use for digestive health, like that's it. It doesn't have thimerosal, which is in an awful lot of other vaccines that people have issues with. It does not have a nanochip. It does not have fetal tissue. It does not have an awful lot of what other vaccines have had. And it was a really nice presentation, I think, and kind of thinking about what people are hearing, and that it's important just to remind folks that this is amazing technology, but it is cleaner, in the words of medicine, than many of our other vaccine trials. So I just want to put that out there because I hadn't heard it in that way. And I thought that was a nice way to kind of grab an explanation of what mRNA means, which is an email to your immune system, or a message to your immune system as to what DNA in a virus is coming and to get ready. That's basically what vaccine is. So that's my share for today. I'm very excited that the PD population will finally get their turn. I've been hearing a lot about just the turmoil that young parents, just imagine a young parent. Just yesterday in NPR, someone called in saying, she had a baby 4 years ago and another baby during COVID, and her coping is so much different because she can't do play dates, she can't go to the library, daycare is canceled left and right. So, we're still, my view, to keep things in perspective, is still the burden on hospitals and the burden on the unvaccinated who are not qualified to be vaccinated. So please know that's part of our equation, and it feels slow, but it's also the safer option. Thank you.
Thank you. Thank you, Jen. Laurel, thank you for all your hard work. Jen, did you have anything to add?
The only thing I just wanted to add is if you do want to sign up for that booster clinic, wakefield.ma.us, that's our website. There's a big button on the homepage you can click on for all the details.
Great. Thank you. Thank you very much. Thank you again for everybody's efforts. Does anybody have anything to add? Okay, great. Well, thank you. Again, there are spots at the clinic that's available. So I kind of find that saying that very hard to believe when we had our first clinic and we were at the door, banning the door because we had a lot of people that weren't eligible trying to come in. So, you know, please take advantage of these opportunities. If you have any questions, please give us a call or shoot us an email. And again, everybody, hearing the sleet hit the windows here at Town Hall. So please stay safe. If you have to go out, be nice and slow. Take care, everybody. Have a great week. Bye.